no one is going to be paying any additional cost. They'll never use their credit card. They'll always use their OHIP card.
Publicly funded, but privately delivered is just one of the steps that the Ford government is taking to alleviate some of the immense pressure on our very broken healthcare system. Hello, I'm Adrienne Batra. With me is Brian Lilley from the Toronto Sun. Brian, the announcement has come that the Ford government is going to be looking at what I just said. Publicly funded, but privately administered surgical procedures in the province of Ontario. Other provinces have tried it. What can you tell us?
Well, it's something that will move the whole system forward. And that's not just me talking. That's the Ontario Hospital Association, the Ontario Medical Association, Dr. Andy Smith from Toronto's Sunnybrook. They've got a surgeon from St. Michael's Hospital, an orthopedic surgeon, who does knees and hips and things like that, saying, yeah, this will work. Dr. David Jacobs, president of the Ontario Association of Radiologists, saying their plans for more MRIs, including using private and not-for-profit community clinics, is great. It's going to give you quicker access to service. That's what this is all about. The NDP and the Liberals want to make this about evil privatization and you're going to pay for everything now. That's not what this is about at all. It's about the Ontario government saying our hospitals are overwhelmed. We've got 206,000 people waiting for surgical and diagnostic procedures. We can speed this up by using existing community clinics, and eventually they're going to open up more of them, not with their money, but with private or not-for-profit groups saying, we will do this service for you. Just pay us for the service, the same way you pay the hospital, the same way you pay the doctor's office.
Okay, so we know that the pushback from some of the hospital leaders is really more about protectionism. They want to make sure that all those services are provided within the hospital system. But there is
well,
no
you've got
one.
the Ontario Hospital Association out there saying this is good. UHN, the biggest hospital in the province, says this is good. St. Michael's, Sunnybrook. The list goes on, hospitals in Windsor and Ottawa. So they've got the majority of the hospitals on side. They are concerned about losing doctors or nurses to this
Fair
system.
enough. Yeah.
And the government says, we'll work with you to have guardrails on that.
So let's just even step back for a moment. There is no one in this country who has either waited for or is in the process of waiting for a procedure, a medical procedure, to go see a specialist to then eventually get a hip replacement, a knee replacement, cataract surgery, the growing number of Canadians with an aging population who need cataract surgery. No one believes that the system is working. It was a system that was under immense pressure prior to the pandemic. And with so many years of lockdown in Ontario, it just exacerbated those lists. So the goal, from my understanding, is to work with these private clinics to have them do the procedures, but people have those that are opposed, Brian, think that you're going to go there and you have to pay with your debit card. That's not the case at all. You don't pay with your debit card to go to the doctor when you go get blood work, when you get a scan. This is all publicly funded already. This is now just expanding that umbrella, is it not?
It is. It's just like when you go to your family doctor's office, if you're lucky enough to have one, that is a private corporation that you're going to visit. Your doctor either owns or works for a private corporation that is paid by the government to see you, give you a prescription, give you a treatment, give you advice. From that fee and the fees they get paid for other patients, they have to pay for the rent, the lights, the heating, the stationery, the receptionist, the nurses, out of their private corporation. Those are not government employees when you go to your doctor. You know that there's already 4 standalone surgical clinics in Ontario that do this very same thing. They perform abortions, 4 of them across the province. They're private clinics, and that has been part of the system for decades. You can look to the blood work that you get, the x-rays you get. So many procedures are delivered by private companies, and it's paid for with your OHIP card. Now, there's been a lot of complaints that, well, the province won't ban upselling. Well, there's a reason for that. Upselling on something like cataract surgery. The province provides coverage of up to a certain quality of lens, but there's always improvements in the lenses, and the province doesn't keep up with that in terms of what they will cover. So whether you go to a hospital or you go to one of these clinics that's going to start doing the procedures, they offer you the option, do you want to pay more for these lenses? Some people say yes, some people say no. But it happens in hospitals already. It happens inside our public system. You have to give informed consent. They're not going to charge you automatically for something. If you say no, then it's no, and you get the government approved lens. But there are things like lenses that cover stigmatisms that the government will not pay for. So a lot of people say, well, I want a lens that will fix my stigmatism. They opt to go in for that. That is just part of our system now. We're not going to be running around pulling out the Amex or the Visa all the time to pay for things. You know, if you go to somewhere for a procedure at one of these places and they say, what's in your wallet? You just say, my OHIP card.
It's tremendously troubling when you hear the pushback on something like this, because the public is way ahead of the politicians when it comes to looking at having a mix of a public-private system within Canada. We can look to other jurisdictions around the world where that actually works and it does operate well, and they don't see the wait times that we do. And I think that for those that push back against this are either ignorant of or refuse to acknowledge the existence of the private system that is here in the province of Quebec, for example, where it is it's offered quite readily to have a private MRIs, for example. But we know that it's a 3-4 tier system already. They always say evil 2-tier system. No. It's a multi-tier system. But to be abundantly clear, this is still operating within the Canadian healthcare guidelines. This is all under under the Act. This is all very much within that. So what is different here? What is it that Ontarians are going to wake up to tomorrow and say, okay, now I have a better option? What's different?
So what's different is you will get quicker access to care. Will it be tomorrow? Maybe a few days, maybe a few weeks down the road. But starting this year, it's just shy of 20,000 additional cataract procedures will be offered. So they're going to allow 3 new clinics that already do eye surgeries, and some of them might do things like LASIK or other eye procedures. They have the ability. They have the doctors that also work in the public hospitals that can't get the OR time that can come in and perform your cataract surgery. There's 14,000 of them. I think it's 4,800 additional procedures at existing clinics, like the not-for-profit Kensington Clinic in Toronto, where Doug Ford made the announcement next to Health Minister Sylvia Jones. There's going to be 900 other non-cataract eye surgeries that will be performed, 1,000 gynecological surgeries that can be performed in outpatient clinics will be funded through this. I think it's 2,800 plastic surgeries. Now, this is not someone getting a nose job unless it's reconstructive. It's soft tissue repair. Somebody needs hand surgery. That's a plastic surgeon that often does things like hand surgery. All of that, 49,000 hours of new MRI and CT scans. These are all good things. This whole announcement is about quicker access to care. And what the NDP, the Liberals, the Greens, and too many in the media wish to do is say, no, you shouldn't have quicker access to care. Even inside the public system, you should have to wait. So that this is only performed by government employees who are unionized. That's not where the public is. The majority of the public says, as long as I'm paying with my OHIP card, not my credit card, I don't care. So this is a win-win-win for people.
Universal, publicly funded and publicly delivered healthcare is a fundamental right of every resident of Ontario. We will use every tool we have in the toolbox to fight them on this.
Altering the foundation of our healthcare system is not something to be taken lightly. The shiny prospect of on-demand surgery and diagnosis is enticing, but we must not allow Doug Ford and Sylvia Jones to sell us on their myopic vision for Ontario healthcare.
It's the ideology. Some people will just, let's leave it alone. Let's just keep doing the same old thing and expect a different result.
You talk about other places doing this. Yeah, Quebec does it. Quebec has a very active, it's the most socialist place in the country, but they have a very active private healthcare system where you can go and buy your way to the front. But the government there has also contracted out for these clinics to perform surgeries inside the public system. That's not what we're doing here. This is still the public system. In Alberta, Saskatchewan, in British Columbia, run by the NDP government, it's nearly 20% of their surgeries are done outside of hospital settings now, often in private or not-for-profit clinics. That's what we're doing. We're doing what is done in other provinces and in other jurisdictions with universal pay systems such as Britain, France, Australia, Germany.
Healthcare delayed is healthcare denied, and this is just one step that the Ford government is taking to try to alleviate the pressure on the current system. Log on to Facebook and Twitter, let us know what you think, and go to thetorontosun.com for more coverage on this story and videos you will not find anywhere else.